special news report on smoking. So, the American Cancer Society has just been notified that the American government is presently holding discussions on the smoking laws in the U.S. Within the next week, Congress will decide if smoking will become illegal within our country. Now over to Carolyn with some more info on how smoking affects your body.
Hi, I'm Carolyn, here with Dr. Johnson, and we're here to talk about how smoking affects your body. So, what parts of the body does smoking affect?
Well, smoking affects a lot of the body. It affects the respiratory system, the circulatory system, the immune system, the musculoskeletal system, and other main organs.
Okay, well how does smoking affect the respiratory system?
Smoking irritates the windpipe and voice box. There's also reduced lung function, and also breathlessness due to swelling and narrowing of the lung airways and excess mucus in the lung passages. With smoking, there is increased risk of lung function and symptoms such as coughing and wheezing.
Well, how does smoking affect the circulatory system?
When you smoke, less oxygen is carried through the blood because you have a narrowed windpipe, which causes less oxygen to get into the bloodstream. Atherosclerosis, which is the buildup of fat, causes damage to the lining of arteries. And this also causes an increased risk of stroke and a heart attack due to blockages of blood supply.
What happens in the immune system?
When you smoke, you have a greater chance to be harmed by infections such as pneumonia and influenza. When you get a disease, it is going to be more severe and longer lasting. And there are lower levels of protective antioxidants such as vitamin C in the blood.
What happens in the musculoskeletal system?
Well, if you smoke, you have tight muscles and you also have reduced bone density, meaning you don't have hard bones.
What happens when you are a long-time smoker?
There's a possibility of cancer in the lung, mouth, nose, larynx, tongue, nasal sinus, esophagus, throat, pancreas, bone marrow, kidney, cervix, ovary, uterus, liver, bladder, bowel, and stomach. Lung disease such as chronic bronchitis and emphysema are possibilities as well. While smoking, there is poor blood circulation in feet and hands, which can lead to pain and, in severe cases, amputation.
Well, thank you for your time, Dr. Johnson.
It was a pleasure. Thank you for that opportunity.
No problem. Back to you, Sally.
Thanks, Carolyn, for that interview. So, Congress has still not decided whether smoking should become illegal in our country. Please stay tuned for more information on smoking. Here is an anti-smoking commercial.
Runners, on your mark! Get set! Go!
Yes! Are you okay? Yeah, I think I just collapsed. Are you sure? Well, I guess that's not a problem. I think I think it was because I started smoking 3 years ago. Do you know how bad that is for your body? I know, but I was under peer pressure and then I just got addicted. Don't smoke.
Don't ever smoke. It is bad for your body.
Hi, I'm Julie, and I'm here with Sally. So Sally, what did you think about the anti-smoking commercial?
I thought it was great because I think it'll influence kids not to smoke. So currently, Congress is still thinking about whether smoking should be banned in our country, but they are very close to their decision. So in the meantime,
I'm going to ask Sally a few questions about how advertisements for smoking affect teens. Okay, how much do kids under the age of 18 smoke?
each day, 6,000 children under the age of 18 start smoking. Of those, 2,000 will keep smoking. That is 8,000 new teen smokers every year. Okay, where are teens most likely to find ads for smoking? Teens can find ads for smoking anywhere from magazines to direct mailing to internet marketing. Okay. Do advertisements for smoking occur most through the public appearances? No matter where you are or what you are doing, advertising is around you in some way. Store windows, billboards on the side of the road, internet ads, and even your favorite weekly TV show are some of the many ways advertisers reel you in. About how many teens are exposed to smoking ads each day? On average, young people are exposed to 3,000 ads per day. Advertisers target children at an early age in hopes of developing a preference to their product as soon as possible. They also target women and girls, trying to get cigarettes more pretty and pink. Nearly $250 billion is spent yearly on advertising to sell almost 900,000 different brands.
And the last question is, what are the most known ads to be exposed to children?
Well, a report of in 2005, data indicated that the three most heavily advertised brands are Marlboro, Newport, and Camel. And they were preferred by 81% of the U.S. youth aged 12 to 17 years.
Okay, thank you for being here with us, Sally.
You're welcome. Thanks for having me.
Yep. For Channel 9 News, I'm Julie, and now over to Carolyn and Megan.
Thanks, Sally and Julie. It's Carolyn again, but this time with Megan. Megan is a long-time smoker that has been smoking for 27 years. So, Megan, do you regret smoking?
Well, sometimes I do, because when I go places, people stare at me and wonder why I have this too and what it is. And it sometimes makes me not be able to express myself and be who I am. And other times, it makes me feel good and relaxed.
Why did you start smoking?
Well, I hung out with the wrong group of friends, and they influenced me to start smoking because they made me think it was cool.
So, peer pressure.
Yeah,
What is that tube on your throat? What is it?
it is a tube that helps me breathe, and it filters any of the air I take in, and it is connected to my lungs, and it helps me breathe since I can't breathe while on my own.
Okay. Are you still able to smoke?
Yes, but I don't do it as much as I used to because it disturbs my lungs even more when I have this tube connected to them.
Okay. How does smoking affect you now?
It has affected me in many ways because now I have cancer and I have lost my hair and I have to wear a wig now. And I have to have this tube in my throat and it makes it very hard to breathe. And I have to hook up a tube to eat.
Thank you, Megan, for your time. Now back to Sally at Channel 9.
Thank you.
Congress has come to a decision that smoking will stay, but there will be more restrictions. There will be more restaurants that allow smoking, but they will also have smoke-free areas. Parks and schools will restrict smoking because of the amount of children, which is very good because they will prevent secondhand smoking, the act of inhaling chemicals even though you aren't the one smoking. Also, in parks is nature, and at preventing smoking, that is great as well, because then the nature will not be damaged. And that's it for the smoking special. Thank you.
Remember, the side effects of smoking are severe. It is possible to get lung cancer and cancer of many other organs in your body. It affects the respiratory system, the circulatory system, the immune system, and the musculoskeletal system. You could possibly even die from smoking. While smoking, there's a poor blood circulation in feet and hands, which can lead to pain and, in severe cases, amputation. Remember never to smoke even when you are under peer pressure.